Mm-mm. Ugh, we gotta talk about chemo drugs. Here we go. I just took a break. I had some goldfish. Let's do this. We'll push my hair all the way back. Antineoplastic. So there's two different types of antineoplastic drugs. There's cell cycle specific and cell cycle non-specific. We're going to start with cell cycle specific. Okay. This means that the drug is going to work in a specific portion of the cell cycle. That's why it's specific. We're going to start with antimetabolites. And hopefully I don't burp a lot because I just had some goldfish. And I don't know why goldfish would make me burp, but we're just going to go with it, y'all. Who knows? Okay, antimetabolites. These are for solid tumors. They can also be used for hematologic cancers, so like cancers in the blood. Can also be used for rheumatoid arthritis and psoriasis. So the method of action, the way that it works, is that it inhibits cell growth by stopping the synthesis of folic acid, purines, and pyridamides. This inhibits DNA and RNA synthesis. So, since it inhibits the cell growth by stopping the synthesis of folic acid, purines, and pyridamides, there are three different categories. Those that are folate antagonists, those that are purine antagonists, and those that are pyridamide antagonists. So, we're going to start at the top. First of all adverse effects of antimetabolites include alopecia, so like thinning of hair or hair loss, nausea and vomiting and diarrhea, myelosuppression, which is bone marrow suppression, metabolic toxicity, palmar-plantar dysesthesia, say that 5 times fast, Stevens-Johnson syndrome, which is sores on the mucous membranes from the mouth to the butt, because that's a whole mucous membrane. It can also lead to toxic epidermal necrosis, which is large areas of peeling. So the first antimetabolite that we're going to talk about is a folate antagonist, methotrexate, which is Trexol or MTX for short. This leads to immunosuppression and anti-inflammatory. So it suppresses the immune system and it's anti-inflammatory. It's available oral and injectable, and a high dose of this can lead to bone marrow suppression. So methotrexate needs a rescue drug to save the day. The rescue drug is leucovorin. I can't talk. Words are hard. Leucovorin is the rescue drug for methotrexate. Leucovorin or Welcovorin. God, I cannot talk. Welcovorin, because the V is in this one right there. Leucovorin or Welcovorin is the rescue drug for methotrexate. This is given after methotrexate. So they have methotrexate on Monday. They take leucovorin on Tuesday. This rapidly converts to folic acid in the body, so it's going to protect healthy cells. So again, methotrexate is a folate antagonist. They take that on Monday. Then on Tuesday, they come back to the doctor and they take leucovorin, which converts to folic acid in the body and is the rescue drug for methotrexate. Okay, so this is the folate antagonist. This is the rescue drug for that. Okay, so that's your one category right there. One and done. The next category is purine antagonist. This drug is fludarabine. It's called Fludara. That's the brand name. Fludarabine treats chronic lymphocytic leukemia, and this is injectable only. That's all I have to know about this drug. It's injectable only, and it treats chronic lymphocytic leukemia. It is a purine antagonist, fludarabine or Fludara. The next category that we're going to talk about is pyridamine antagonists. There are three. We have cytarabine, fluorosil, I have no clue, and capecitabine. Again, I'm probably butchering these names, but I'm trying my best, y'all. Woo! Okay, so cytarabine is known as Ara-C or Cytostar. It is available many different ways. It's available IV, SQ, subcutaneously, and intrathecal, which sounds really gross, but it just means it's going into the spinal column. So that means this drug, cytarabine, can pass the blood-brain barrier. Since it's going into the spinal column, it can go straight up to the brain. It's going on that little highway called the spinal cord to your brain. So it can cause cytarabine syndrome, which is fever or bone pain, and it usually happens 6 to 12 hours after the administration of this drug. This cytarabine syndrome is prevented with corticosteroids. So that's pretty self-explanatory. I don't know why I'm trying to further it. Cytarabine can cause cytarabine syndrome, which is prevented with corticosteroids. This drug is excreted the exact same way, so it can come out in tears. So a way that we can prevent this is that we can provide eye drops to the patient, specifically dexamethasone, which is Decadon, and give it to them in an eye drop form so that it can prevent conjunctivitis. Cannot say words. Conjunctivitis. There we go. I don't know. Cytarabine, it's excreted the same way. Like it doesn't change much from the body. And so in order to prevent conjunctivitis, you have to give your patient a corticosteroid eye drop, which would be dexamethasone or Decadon. Words are hard, y'all. What's my name? Who am I? The next drug that's a pyridamine antagonist is fluorouracil, which is 5-FU or Aduracil. This is for colon cancer, and it's an injectable only. I was talking to somebody yesterday, and the way that I remembered this, if you look at it, there are 2 R's. So colon cancer, the colon ends with the rectum. So there's 2 R's, and there's some U's and some O's. And if you look at it, ooh, that's going to get dark because the paper fell. If you look at it, I don't know, it just reminds me of like a colon because there's a bunch of O's and like the colon is like a long tube of O. I don't know. It reminds me of colon cancer. I don't really know why, but that fluorouracil is for colon cancer, and it's an injectable only. It's a pyridamine antagonist. It's a good thing to remember. The last pyridamine antagonist is capecitabine, which is Zeladol, but it starts with an X, but I'm pretty sure it's pronounced like Zeladol, like a Z. This is a prodrug of fluorouracil. This is the only oral drug that is a pyridamine antagonist. Oral pyridamine antagonist. Something for us to remember. It acts in the S phase of the cell cycle, and it's for metastatic breast or colon cancer. The next cell cycle specific section that we're going to talk about is mitotic inhibitors. This is often used in combo therapies. It's for solid tumors, hematologic malignancies, and then hold on to your horses because we got a lot of words. I'm going to bring it in close for this. We have testicular, breast, ovarian, Kaposi's sarcoma, small cell and non-small cell lung cancer, and acute leukemia. That's all what I just said right there. Hopefully you can read that. I don't know. The method of action is that it works before and after mitosis, so it retards cell division. This is a good thing to know. Adverse effects of this, again, are alopecia, nausea and vomiting, myelosuppression, extravasation. Where am I going? Right there. It's in all caps, and there's an exclamation point. So that's something you should know. It causes extravasation. That's where, here's my arm. Okay, pretend I can't put my sweatshirt up that high because I don't want to because it's cold. So I got my IV going on right here, and then like this is the little needle, and it comes, but it's going through like the side of my vein, or the medicine is so like potent that it like goes through the side of my vein. And then I have fluid, which is the medicine, accumulating under the surface. So it can cause extravasation and come out and like go to that surrounding area. So that is something this is not the only drug that causes that. That can happen like when you're giving blood or like giving a regular IV or whatever. It's where like the needle goes through the vein wall, or the medicine like erodes through the vein wall. And like a patient will complain that it's painful or it's burning. and you'll often see like swelling at the site, and it'll be like maybe a little shiny because of the edema or whatever, but it's not a good thing. If you see that with your patient, you have to stop the injection or the flow or whatever immediately. Don't remove the cannula, the little IV tube. Don't remove that. Just stop the injection. And then you can either like suck out the remaining medicine or suck out the blood or apply an antidote or whatever. But we'll talk about that later. But just remember, mitotic inhibitors can cause extravasation. So I don't know how to remember that. Maybe because there's like 2 T's and it looks like people going like, help me, because my arms hurt. Maybe we could remember it that way. I don't know. We'll see. Maybe we'll remember it that way. It can also cause peripheral neuropathy and neuropathic constipation, which does not sound fun. I don't want that. Okay, there's 2 drugs in this category. We have vinca alkaloids and taxanes. Vinca alkaloids, the drug name is vincristine, which is Oncovin. Zoom in on that one. It's an injectable. This is neurotoxic. So if it should be given intrathecally, that is fatal. So it cannot be given in the spinal cord. Again, vincristine is fatal if given in the spinal cord intrathecal. Excuse me. See, I told you I was going to burp. This acts in the M phase. This prevents the assembly of microtubules. I was doing an ATI question or an EAQ question. It was probably EAQ. I think it was EAQ. And it asked me, like, which drug works in the M phase, preventing the assembly of microtubules. And the correct answer was the vinca alkaloids, vincristine. So that sounds like a good question they could ask us. I don't know. I'm not Muscat or Rochester, but I'd ask that. That sounds good. This drug, the vinca alkaloids, can cause peripheral neuropathy and severe constipation. So they are often started with laxatives. Severe. Don't want severe constipation. I do not. The next drug in mitotic inhibitors is taxanes. Paclitaxel, which is so easy because it's a taxane, and then it has Taxol, and then the brand name is Taxol. Like, thank you, people. Come on now. Applause for you. This is an injectable, and it is from the Western Pacific yew tree bark. So that's why I think it was Miss Muscat talking about how, like, don't deforest the rainforest of the Amazon, because who knows, there could be a cure for cancer out there. Because there's a chemo drug that comes from the Western Pacific yew tree bark. This drug is often tolerated poorly, so it requires a lot of pre-medication with steroids or H1 or H2 antagonists. But, I mean, whatever. It acts in the late G2 phase as well as the M phase, causing formation of non-functioning microtubules. So, remember, vinca alkaloids work in the M phase, preventing the assembly of microtubules. And then taxanes work in the G2 and the M phase, are causing formation of non-functioning microtubules. So microtubules, mitotic inhibitors. MT, microtubules, mitotic inhibitors. They also cause extravasation because your people in the T's, these T's are like, I got issues in my arms. Don't know. I think I'm losing it. The next type of drug that we're going to talk about is alkaloid. Okay, bear with me. Alkaloid topiramate blah blah. Okay, topoisomerase topoisomerase 2 inhibitors. I told you I'm not good at pronouncing this stuff. I can't even use words now. Lord help me. Say some prayers. The drug is etoposide. This is BP16. This is the drug. Remember, Miss Muscat said BP. Think of BP. This drug causes hypotension if it's given too quickly or if the drug dose is too high. So obviously, you want your patient to like be sitting or laying down when they take this drug because of the hypotension potential. This drug is for small cell lung cancer or testicular cancer. It acts in the S phase, the G2 phase, causing breaks in DNA strands. It is available oral and injectable. That's pretty much it. And now another word, which is the same word, topoisomerase 1 inhibitors. This is irinotecan. I think that's how you say it. And the brand name is Camptasar. This is for ovarian or rectal cancers. It acts in the S phase, causing DNA to break. It is available in injectable only, and it causes severe diarrhea. Remember, Miss Muscat said irinotecan is like I ran to the can. This is the drug that causes that severe diarrhea where it happens so quickly that you cannot rehydrate the patient with fluids and electrolytes quick enough, and it could possibly be fatal. So yeah, that's not a good thing. Okay, the next ones that we're going to talk about are the antineoplastics that are cell cycle non-specific. Yeah, it's in yellow, but you can pause it if you really want to read it or not. So we have 5 different categories. We have the alkylating, cytotoxic antibiotics, miscellaneous antineoplastics, hormonal antineoplastics, and radiopharmaceuticals. So we're going to just start up here and work our way through. So the alkylating antineoplastics are for ovarian, brain tumors, lymphomas, leukemia, breast, bladder, and other. It literally said other in our notes, other types of cancers. It works by prevents reproduction by altering DNA chemical structure, which is called alkylation. So obviously alkylating antineoplastics prevent alkylation. See? Right there. So adverse effects of this are nausea and vomiting, myelosuppression, alopecia, nephrotoxicity, ototoxicity. We'll come back to talk about those in a second. Peripheral neuropathy and extravasation. So nephrotoxicity is like toxicity of your kidneys, and ototoxicity is toxicity of your ears. So there's technically 4 drugs that we're going to talk about, 2 that are pretty much the same. So meclothoramine, right there. It's like brand names are Mustine and nitrogen mustard. This was that first chemo drug that they actually used as mustard gas, like during World War I, and this is not a good thing. You don't want to get gassed like in a war. It's not a good thing. It can be used for lymphoma, and it's parenteral or topical. So that's the way they used it in World War I. They like sprayed mustard gas on people, and it was a topical. I guess it was also technically inhaled, but there were just bad things going down. It was World War I. The next drug that we're going to talk about is cyclophosphamide, which is cytotoxin here. It's actually a prodrug of the nitrogen mustard gas, this one up here. It is for organ rejection prevention, autoimmune diseases, and lupus, which lupus is an autoimmune disease. And organ rejection kind of is like an autoimmune thing because your body's like attacking, so it's not technically itself anymore. Like if you get a kidney transplant, it's not your kidney, so your body's like attacking it. This drug, cyclophosphamide, can cause hemorrhagic cystitis. Don't forget about that. It's available in oral, IV, and SQ forms. So a nursing implication of this is that you're going to want to increase fluid intake 2 days before chemo. The next 2 drugs in this class of alkylating antineoplastic drugs is cisplatin and carboplatin. That is platinol and paraplatin in layman's terms. These drugs contain platinum so that they can cause a metallic taste in a patient's mouth, which is super easy because it looks like it says platin, Platin, in both of them, and platinum looks similar to that. So these can also cause nephrotoxicity and ototoxicity, so toxicity of the kidneys or toxicity of ears. The next class that we're going to talk about is cytotoxic antibiotics. This is often used in combination therapies. They are derived from natural substances from mold, so like the Streptomyces. Just something to know. But if you think about like penicillin is derived from mold, and like penicillin grows on bread. I don't know why. Well, I guess bread isn't technically a natural substance, but I want to think it is. It's naturally amazing. I love it. Okay, cytotoxic cytotoxic antibiotics are for solid tumors, hematologic cancers, leukemia, ovarian, breast, bone, squamous cell, AIDS-related Kaposi sarcoma. So it's for a wide range of different things. The adverse effects are pretty much the same as the others, including alopecia, nausea and vomiting, myelosuppression. This is the area where it can cause pulmonary fibrosis. It can also cause toxicities of the liver, the kidney, and the heart. But you really need to remember that it's pulmonary fibrosis. A lot of my EAQ questions earlier were talking about the cytotoxic antibiotics and it was talking about pulmonary fibrosis. So just remember that. It works by blocking DNA synthesis. So the first drug that we're going to talk about is doxorubicin. And let's try to say the brand name. Who knows? Adrenomycin, I think. Okay, it's red in color. This is that red devil drug that people talk about. It's a powerful vesicant, so it can cause extravasation in the veins. If you look at it, it's got RUB, which is kind of like ruby, and that's the red in color drug. It is an anthracylene antibiotic, which can cause cardiomyopathy. So let's just recap that. Doxorubicin is red in color. It's a powerful vesicant. And it is an anthracycline antibiotic, which causes cardiomyopathy. So the next class under cytotoxic antibiotics is bleomycin or bleonoxane. It's a other cytotoxic antibiotic. Whatever, there's a class for other. Who cares? This can cause pulmonary fibrosis and pneumonitis. Titus. No, there's not two T's. There's one T. Pneumonitis. Maybe I'll go Google how to say that later. I don't know. This is cell cycle specific and it is toxic to the lungs. So remember how we talked about how pulmonary fibrosis is an adverse effect of cytotoxic antibiotics? This is the one that is the big bad guy. It's bad for your lungs. So for these drugs, the patient can only receive a certain amount of this drug during their lifetime. So do you remember how Ms. Muscat was talking about how after Hurricane Katrina, patients that were receiving chemotherapy, specifically bleomycin, were coming and saying, look, I'm taking chemo and I'm pretty sure I'm taking bleomycin, but they didn't have any records of these patients because the files were like lost in the flood. That's not good. Patients need to know like the number that they're at. So like hypothetically, let's say the most that a patient can receive in their lifetime is like 100 milligrams. And they are 29 years old, like me, and they've had chemo several times, and I've gotten my limit. I've gotten to 30 milligrams. Well, the rest of my life, should I need to take this drug again for a recurrence of cancer, I can only have 70 more milligrams of this drug. So it's important that records are kept both like in doctor's offices, whether they're digital or I guess hard copies. It's not really a great way to save the file anymore. Or making sure that a patient has a copy of their paperwork so that they can know the limit of where they are with this drug. That's bleomycin. I guess it could also be for doxorubicin, but cytotoxic antibiotics is the class of drugs where patients need to know your number. Like, you know how they have that like campaign of like heart disease and like know your triglyceride level and know your HDL and LDL levels. Well, cancer patients who are taking cytotoxic antibiotics need to know the number that they're at, whether it's they've reached their limit of 100 milligrams in their whole life, they can't take the drug anymore, or they've only had 30 milligrams out of 100, they need to know their number. I wrote it as the patient needs to know their current score of the drug taken, but that's just my terminology. It's just whatever. Okay, and next, it's not like the next category. I think it's technically the last one listed, but we're just going to go to it because that's where I have it written, is miscellaneous antineoplastics. Imatinib, who knows? I don't know. Gleevec is the brand name. That's pretty easy to say. I'm cool with that. It's a tyrosine kinase inhibitor, so it's a targeted therapy. It is taken orally, and it's for chronic myelogenous leukemia. So there's going to be many adverse effects in drug interactions. So the patient, when they're taking this, their doctor really needs to know like their drug history and They need to stay on top of like what their adverse effects are. Hydroxyurea is hydria. It is cell cycle specific and it interferes with DNA synthesis. It works in the S and the G1 phases, and it's an antimetabolite. This drug is taken orally, and it is for squamous cell cancer as well as leukemia and sickle cell anemia. This drug can increase fetal hemoglobin levels, which decrease HbS concentration. I don't really know what HbS concentration is, but it was written in our notes. So just know that hydroxyurea increases fetal hemoglobin, which decreases HbS concentration. I don't know what HbS stands for, but it was in our notes. Maybe I should go. I just need to have a list of things to go Google later. Whatever. Adverse effects of this drug include edema, drowsiness, headache, and rash. And there are multiple drug interactions. That's a nursing implication. Hormonal antineoplastics, they're divided by female and male. These drugs are used to oppose or block sex hormones, and it's used as adjunctive and palliative therapy. So, for the females, tamoxifen, which is Nolvadex, is a selective estrogen receptor modulator, which is a SERM. Do you remember talking about SERMs earlier with osteoporosis? Because I sure do. Let me get my notes. See, look, we're flipping back in time. SERM. Selective estrogen receptor modulator. Woo! It's a SERM. Remember, SERMs are the ones that you have to stop 72 hours before you get on a flight, or you know that there's going to be prolonged immobility because it has an increased risk of blood clots. So, tamoxifen is the drug. Nolvadex is the brand name. The next drug is Megstrol. I don't know. Megrance is the name. It's a progestin, and it also stimulates appetite. Ooh. For males, we have bicalcamide, which is Casodex. It's an anti-androgen, and it stops prostate cancer growth. So let me let you have a moment to look at those lovely names. Can you see it? Can you see it? There you go. Our last category in antineoplastic cell cycle non-specific are the radiopharmaceuticals. We really just talked about sodium iodine, which is I-131. Those are 1, 3, and 1. It just looks funny. This is for thyroid cancer or hyperthyroidism, and it is administered by a nuclear medicine specialist. So this is that thing where iodine can be toxic to the thyroid, so they make it radioactive, and then they put it in there, and then it like kills the thyroid cancer. So fancy. Okay, so we're going to take a brief break, and we're going to come back with some more cancer stuff. It's not specifically cancer drugs, but it's drugs that you take along with cancer therapy to like protect other parts of your body. Woo!